Hey, everybody, and welcome back to the Rett Dad. Thanks for coming back and joining me again. I am glad that you came back to join me. Hit the follow button below and like the video if it's informative to you and if it provides some good information. Last time I was talking to you guys, I talked to you about what is Rett syndrome, and I kind of gave you the background of it, of where it come from, how it came to get its name, where some of the things are that we see with these girls and sometimes boys. But I wanted to go into this time a little more information of kind of what we see with girls or with kids with Rett syndrome. I got to quit. Girls are your primary. The reason I say that is if you didn't watch my first video, girls are the primary people affected by Rett syndrome. So it's primarily females that are affected because it's the X chromosome. So that's why I say girls. So if I say it, I'm sorry. I mean kids, okay? Because there are boys that are affected by Rett syndrome as well. Sorry about that. I thought I saw something out the corner of my eye out in my office here. So let's look at this a little more now. As I ended the last one, I was talking to you guys and telling you that Rett syndrome affects just about every area of these kids' lives. It affects nearly every aspect. And that varies from child to child. But some of the most common things that we see with Rett syndrome is the lack of ability to use their hands. These kids have a lot of hand wringing motion, a lot of hand washing motion, a lot of stimming that with their fingers and with their hands and everything. So it affects that part of their life, and that's something that really, if you stop and think about it, that's really something detrimental to them, is that they can't use their hands, because without their hands, they have a lot of problems with doing everyday tasks. They can't feed themselves. They can't bathe themselves. They can't, they can't go to the bathroom by themselves a lot of times. They can't get their own drink. It's just a lot of things that anything that you can think of that you use your hands for, they can't do that if they can't use their hands. So it's the lack of ability to use their hands. The other thing is they lack the ability to walk. Although some can, some people, some Rett people can. I have seen some at the Rett syndrome conference that we went to. But Rett syndrome affects greatly the ability for them to walk because it's affected the brain. Remember, this is a neurologic disorder, so to speak, and that's why you see some of the things that you have, which we're going to get into here in just a minute with some of the other things. You'll see that a little more. Hypotonia, and this affects both the hands and the legs kind of things, or the arms and the legs. Hypotonia, so it's a hypotonia, if you've never heard of that, is kind of a global low muscle tone that you have. So hypotonia is something that's very common to these kids. And with hypotonia, it affects a lot of different things. It can even affect their swallowing. So you've got to stop and think about that. Aerophagia. Okay, aerophagia. So what that basically is the swallowing of air. Slurping. Anna does this a lot. We actually have to. She's got a G tube, a Mickey button, and we actually have to vent her to be able to get a lot of the air that she gets from this aerophagia, from the slurping and everything. We actually have to vent her in order to get some of that taken care of. So you've got to look at that, and you've got to think about that with these kids whenever they have that. One of the things that you don't necessarily think so much about with muscles and everything is constipation. Your bowel, your gut, is basically one big muscle, and it's got a process called peristalsis that actually just helps massage the stool through the bowel. And I know that's gross to some people, but it just is what it is. It's the thing that you have to think about with that. And whenever you have low muscle tone, that affects your bowel, that affects your gut. So these kids don't process things through like they should. And it gets to constipation problems. So you've got to look at that as well, and you've got to be prepared for that. There's a lot of different things that you can do to help with that, just simple things like, Miralax or Milkamag or different kinds of laxatives and things like that, just to kind of get the bowel moving a little more to help get things going. Anything that you can do to keep, this is not meant to say limit these kids at all. I don't want to do that at all. We don't limit Anna in what she eats. We will give her whatever she can safely eat and whatever she can chew and whatever she can manage that she likes, because we don't limit that. We want her to have all the sensation and everything that she can. We want her to have the sensation of being able to feel the textures of the food. We want her to be able to have the sensations of swallowing and all those things. We want her to have as normal a process as possible. So we use her G-tube a lot for meds, but we also do supplement with her. So when you think about that, that's one of the things. Now, I'm going to go down this little rabbit hole for just a quick minute since I'm on a G-tube thing here. I really hesitated, and my wife more than me, to go that route, to go the G-tube route. I work with people who have airways and things. So I work with people that have trachs. I've worked with people that have gastrostomies. I've worked with people that have had G-tubes or J-tubes or, all kinds of different things. And I've seen how some of those people have increased probabilities for infections. It is an indwelling line, kind of thing. Okay, so in healthcare, that's one of the big things that we look at is indwelling lines. So an arterial line, a central venous line, even something as simple as an IV, a PICC line, all those different kinds of things, any kind of line that we have, we look at that as a source of potential infection, and we have to take really, really, really good care of it. We have to make sure it's cleaned really, really, really well. So that was kind of my resistance to it. My wife just didn't, she was of the mindset that she didn't want to deprive her of anything food-wise, and she felt like that was going to do it, that we would just go to tube feeds with Anna, and that would be it. We wouldn't do any more feeding, and the doctor and I both told her, like, no, you can supplement. You don't have to go wholeheartedly into tube feeds. You can just supplement. Give her what she wants. Give her what she can tolerate. Give her what she does well with, but then supplement. So we've had to do that. So when you look at that, when you think about that, don't hesitate to get these kids a gastrostomy tube. You just have to take care of it. Clean it really, really, really well, okay? Use soap and water. Get around it really well. Take extra good care of it. Use cotton swabs if you need to get around it really well. You can use peroxide and water to be able, don't use straight peroxide. Mix it up, okay, 50-50. And because what it can actually, using peroxide too much around the site, whether it's a trach or whether it is a G-tube or whatever, it can irritate the skin. It can actually sort of cause burns at some point, because you use it so much. So when you think about that and when you look at that, just be really careful with doing it. And then once you've washed it with that 50-50 peroxide, go back over it with just water, but make sure it's clean water. You might want to buy you a bottle of sterile water and pour a little out into something that is clean, a cup, a disposable cup of some kind, something like that is going to be clean. You can buy sterile containers and things to use. Scald them out really good, boil them, whatever you want to do to take care of that, to clean it again. There's lots of things you can do to clean that bowl if it's reusable. So don't ever hesitate to do that. Now, I'm going to get back off of that subject. That's kind of a rabbit hole I went down there, but I did want to tell you that don't hesitate with some of these things. If it's something that's going to benefit you, got to look at the cost benefit analysis with these kids. But it's something, if it's going to help them, do it. One more thing I'm going to get on with the aerophagia that I had talked about. Make sure you get that gas out of their stomach before it processes through. If you've got a G-tube, man, if they have a G-tube, pull the air out of that G-tube before it gets into their actual bowel. Because if it gets into their actual bowel, man, it's miserable for them the whole time it's processing through. It's like having cramps like you wouldn't believe. So the constipation sometimes is nothing compared to the air in the bowel. All right. The inability to speak. Now, this is something that's huge with these kids. I don't know, I've not seen any kids yet that can actually speak with Rett syndrome. There may be some out there, and I just haven't seen it, or I haven't seen anything about it yet. But that's something that's big, and that's why I talked to you in the last video. I kept bringing up the Toby. The Toby is Anna's speech device that she uses. Anna is able to talk to us by looking at, with her specifically, she looks at a picture. Let's say it's a picture of a fork and a plate, and it tells us that she wants a bite. That page, we can program it then to go to another page if we wanted it to, and she can tell us specific things that she wants a bite of. So we've done this with things for her snacks. So, for example, we've got one that's got oranges because she loves mandarin oranges. It's got fruit cup because she loves fruit cups. And we've got one that's for pudding because she loves pudding. Now, she makes a mess with pudding. Holy cow. But she likes it. Again, okay, fine, great. You're going to eat it. That's fine. And she does. So look at the devices. Look at the ways that work for these kids. Find what works for your child. Do not go with any one device just because a speech therapist says that is the device. Make them try it. Make them try it against other devices. Get home demos with it. Look at other variations. We used, for a long time before we got her Toby, we used cards essentially that had pictures on them, and we would hold one in each hand, and she would sit and look between them, and then when she would settle on one, we knew that was what she wanted. But she would analyze them, and she knew that when she settled on it, that was what it was. So we were really careful about that with her, and making sure that that's what she wanted, and not that she was just looking at it and thinking for a minute kind of thing. So there's lots of ways out there. There's lots of things that you can do to communicate with these kids. They wanted to try sign language with Anna initially. Well, that was a big fat flop because, and I mean, I got no problems with trying it, but that was a big flop because she can't use her hands enough. Her hands are not functional enough to do sign language. She stays up in her hair all the time, and it's problematic. So that there was no way to do that. It affects their breathing in different ways. There are kids that have ventilation issues that can lead to the inability to breathe on their own, and they can end up having to have a ventilator. And if they end up having to have a ventilator, they will have a tracheotomy. Again, just like with the G-tube, just like with the G-tube, make sure you keep it clean. 50-50 hydrogen peroxide and water, and then rinse it. Now, with any of these things, the other thing I need to mention, dry it, okay? Have some gauze and dry it. Keep it dry. Our GI, and this is, nothing I do is to toot our own horn, okay? I want you guys to understand that. Please understand that. Our GI doctor raves about how good her tube looks. And the home health nurse that comes out and does her assessment raves about how good her tube site looks, because it is immaculate, because we are we're very picky about her G-tube. We are extraordinarily almost to the point of OCD with making sure that it is clean and that it is cared for. If we start seeing crusties and things like that coming up on her G tube, then we make sure that gets cleaned, and we make sure that it doesn't start turning into an infection of some kind. We check the water level in her balloon to make sure that that's not gastric content leaking around, because you don't want her to develop some kind of peritonitis or something if it leaks into the stomach out of the actual, leaks into her belly out of her stomach kind of thing. So we're really OCD about that. So just like with the G tube, the trach is the same way. Just keep it really, really clean. Make sure you dry it and everything. Breath holding, that's another ventilatory defect that we see in these kids. Breath holding is a fairly common thing with kids with Rett syndrome. And breath holding may not show up right away. It did not with Anna, but it has shown up. And there are times that it shows up with a vengeance. And when she starts getting overstimulated, it gets horrible. And you can always tell when Anna is getting overstimulated because she starts stimming in her hair really bad. She gets really, really spastic and just herky-jerky kind of stuff. And we try to, if at all possible, remove her from that environment at that point. There's little tips and tricks that we've learned with that, and some of that is going to be discussed whenever we get to sensory issues and things, because that's another thing that we see. But we're going to finish talking about the breathing effects first. One of the things that comes along with this breath holding that we see is that it can lead to heart rhythm disruptions known as prolonged QT syndrome. And what that is when you look at an EKG, you've got what's known as a QRS complex. That's the big spike that you see on the EKG. Okay, QRS, and it's the different inflection points on the EKG that you're seeing, the electrocardiogram. The QT is where it prolongs out. The T wave is the ventricular repolarization that you see at the end of it. It's the little bump after the big spike. So that's neither here nor there. That's just medical stuff that I get used to going over with students, so I just do it. I'm sorry. But it starts to prolong, it starts to get widened out, and what that is it's taking the heart longer to depolarize and repolarize. So that is to discharge the electrical current for the beats and then repolarize and get ready for the next beat. It's taking it a little bit longer for that. So that's something that they watch with these kids. We have had EKGs done on Anna, looking and making sure that she does not develop QT interval prolongation. Seizures. Seizures is another thing that happens with these kids. So that is something that's fairly common whenever you look at Rett syndrome kids. And seizures is something that can be very scary. I can tell you as a healthcare professional, seizures usually don't typically bother me too much. I just do my thing and maintain the airway and kind of take it in stride until the seizure is broke, or they can get meds on board to break the seizure, or whatever needs to be done is done kind of thing. But with Anna, it was different. We started having seizures with her one night, and they didn't want to stop. And we were having seizures every couple of minutes, literally. And we had probably, by the time we could get dressed and get ready to go to the hospital and get somebody over to take care of our boys and stuff, which my parents don't live too far away. They literally live just a couple of minutes down the road from us. By the time we could get everything squared away, she'd probably had, and we had already called the neurologist and talked to them, she'd probably had 15 seizures. So this was pre-VNS. I'll talk about VNS in just a minute. So that's something that was scary for me, because we couldn't get them to stop no matter what we did. We had done lots of different meds. We had done our rescue plan. We had done the rescue meds on the rescue plan. We had done everything that we had in our arsenal to do at home. The next stop was going to be the hospital. The next thing that we were doing was the hospital. So in looking at that and in doing that, once I got to the hospital, and like I said, I'm in healthcare. When the nurse took Anna from me, that's when everything hit me. That is when the emotion hit me. That's when not the severity, it's not what I want to say. I guess the reality of everything that had been going on had hit me at that point. And so it was weird. It was weird for me. It was an odd sensation because I'm so used to dealing with it, and it was just kind of like, okay. And I no longer had, per se, control of the situation, even though I didn't have control of the situation to start with. It was very, very interesting for me. VNS, I told you I was going to talk about VNS. VNS stands for vagal nerve stimulator. We fought this one too, and why we keep fighting these things that are going to end up being good for her, I don't really know. But I guess it's kind of scary initially to think about these different things, to think about your kid having to undergo anesthesia, to have some kind of surgical procedure, the risks and everything that go along with it. But the vagal nerve stimulator is a little device that goes in the chest, just like a pacemaker. If you've ever seen anybody with a pacemaker, it's a tiny little device. I don't have anything on my desk that's about its size. Honestly, it's smaller than everything that's on my desk here. But it's a small little device that just goes in their chest right there, and then the wire runs up along the you can actually see Anna's wire go over her clavicle. She's skinny enough that you can actually see the wire kind of cross her clavicle right there, and goes up and attaches to the vagus nerve in the neck right there. You could see initially a tiny little incision that they had done to get the attachment to the nerve there. And what this device does is it produces, just like with a pacemaker, it produces electrical impulses. But rather than going to the heart to control the heart, it is actually sending them to that nerve, and that nerve to the brain then. So if it sees like this really high rise in her heart rate, then it will say, oh, it looks like she's having a seizure. Let's get a little more here. So it regularly puts out current. It regularly puts out impulses however often the doctor has it programmed for your particular child. I don't even remember what we've got Anna set to right at the moment. I think it's like every 3 minutes. That it'll put out just a little low intensity pulse just to kind of keep everything in check. And it's set at specific milliamps. It's set at specific currents, electrical currents. And then if it sees that heart rate go up, it ups the dosage a little bit. And it will produce it a little more frequently at that time. If that doesn't stop things, if there's a seizure ongoing and we see that there's a seizure ongoing, then we actually have a little magnet that we can run over it. Now, typically with a pacemaker, when you run a magnet over it, it shuts it off for a minute. As long as the magnet's there, it shuts it off. With the vagal nerve stimulator, when you run the magnet across it, and that's what you do, you literally go from this is what the rep told us, you go from their shoulder to their sternum. And when you cross that magnet, when you go from their shoulder to their sternum, it crosses that magnet, and or the magnet crosses the device. When that happens, it says she's having a seizure that they're having a seizure that we need a little more for. So it'll up the current again to a really high level and hit them with it to try to break that seizure. And the vagus nerve helps to calm the brain down. When we look at the vagus nerve with my profession, with respiratory, we actually, when we are suctioning someone through their trach or something, or through an endotracheal tube if they're on a ventilator just temporarily, we can actually stimulate that vagus nerve and cause someone's heart rate to drop. It creates what we call bradycardia, so low heart rate. So that vagus nerve kind of calms everything down. That stimulation makes everything calm down. It puts out a lot of parasympathetic tone. Sympathetic tone makes you kind of fight or flight. Parasympathetic is relaxed, so it puts out a lot of parasympathetic response. So with that, that device will help hopefully calm those seizures down. And seizures, since we had the vagal nerve stimulator, have gone down tremendously. We don't have nearly as many seizures as we used to, and the ones that we do see are not bad at all. They're usually just very, very, very short-lived. I think my wife had the longest one just the other day that we've had in a long time, and I think it was like 5 minutes that she had 3 or 5 minutes, something like that she had one. And it took us a couple of swipes, and it'll only let you do, one every so often. It'll limit that down. But we had a couple that we had to swipe it a couple of times, and that's really it. So vagal nerve stimulator was something that's been really good for her. Now, she's still on a lot of seizure medicines to control those seizures, but at the same time, it's doing what it's supposed to. Anna has very few seizures at this point. All right. So don't get freaked out about the seizures. Keep your composure. That's the best thing you can do for you and for the kid. Again, like I said, I'm in healthcare, so I kind of compartmentalize things a lot. And that was the weirdest part for me, was whenever that barrier came down to the compartmentalized side of things. All right, scoliosis. So scoliosis is just a S kind of curvature of the spine. It is where the spine twists. So you've got scoliosis and you've got kyphosis. Kyphosis is where they're hunchbacked. Scoliosis is that the spine kind of twists as it goes up. Scoliosis is something that's typical with these kids. It's something that's common, and that's probably because of the hypotonia. Their muscles are not straight enough, are not strong enough to kind of keep that spine straightened up. It's like us sitting with bad posture all the time. So scoliosis is something that these kids fight. Now, that's something that you can work on. You can work on their muscle tone. You can work on their sitting posture. You can work on a lot of different things to kind of help get that spine straightened up. There's different kinds of seats. There's different kinds of braces. There's surgical interventions you could do if it gets bad enough. Lots of different things, and that's something that we're watching with Anna right now. She's got some scoliosis that's going on, and we're watching that. We're watching the progression to make sure that it doesn't get too much worse, and seeing what we can do to kind of help strengthen her up to get her a little more tone in her musculature in her back to help straighten that, keep that from getting any worse. Sleep issues. These kids have a lot of sleep issues, whether it is seizures at night, whether it is not sleeping at night. We have had times with that. Boy, let me tell you, we had one the other night. She woke up at 1:30. We'd give her meds, I think, about 8 or 9 o'clock. She was in the bed. She'd gone to sleep. About 1 or 1:30, she woke up. And when Anna's awake, you're going to be awake too. If you're not getting up and getting her, if she's by herself, she's going to get you up. So I got Anna. She ended up in the bed with us. Ended up watching TV for a little while. She did. I slept. Once I got her in between me and the wife, she slept. So, or she watched TV rather. I slept. But you can tell I don't get sleep enough, honestly, at this point, because of everything. So it's just something you get used to. But sleep issues are something that we have with these kids. So you gotta be ready for that. You gotta think about that with these kids. and sometimes they sleep during the day and don't sleep at night. They kind of get their days and nights mixed up. So it's very confusing sometimes for us. There's lots of different things that happen. So you got to be aware of that. You got to think about that. Sleep issues and sleep disturbance is something that happens. Anna started having occasionally almost kind of like night terrors now. It's kind of weird. There's times that she will wake up and just, you can always tell when it's going to be one of those times because of how she wakes up and the cry that she has. And it's not really a cry to start with. It's almost like a breathing disturbance that she's had, and then it turns into the cry very quickly. So we know when something like that's going on, and the last time it happened, which was last week, man, it took us a little while to get her settled down. It even woke the boys up. They live across the hall from our bedroom. Live across the hall. They sleep across the hall from our bedroom, and it even woke them up. Which they typically, those two don't wake up for anything, but it woke them up, and they came over to check on her to see what was wrong, make sure nothing, that she hadn't hurt herself, she hadn't something else happened, kind of thing. So it took us a little while to get her calmed down, and that's something that happens occasionally with her. So you got to be ready for that. You got to think about that. All right, let's see where I'm at time-wise here. 30 minutes in. All right. So we're going to get ready and wrap this one up here in just a minute. We're going to go through the last really couple of issues that we have here, and then we're going to end it with that. And then we're going to come back to the next episode and talk about treatment. So the next two, which are the last two I have, sensory issues. We talked about sensory issues a little bit. If it is a loud environment, or if there is a lot of things going on at one time, so sitting in a restaurant that's really crowded and a lot of people talking and everything and dishes clanking and all those kind of things, Anna will get overstimulated in a heartbeat. Sometimes we can put headphones on her. I've got a set of headphones that I use whenever I go out target shooting, and they isolate sounds really well, but they also have a volume control on them where you can control sound coming into them, so you can listen to music or you can listen to anything else like that, podcasts or whatever, at the same time as it drowning out the other noise. So we will put those on her whenever we go out somewhere, and it's something that helps to limit things down for her and kind of help control that a little bit. The best thing you can do is just figure out what works best for them. And I say that a lot. And I don't mean to minimize things, and I don't mean to not come up with things, but what works for Anna might not work for your child. And with these sensory issues with her, it is when she gets that overstimulated, when she gets like that, we're done. It is either, if we can put the headphones on her and get her to settle down, that's one thing. If not, we have to remove her from the situation. I have had to get up and leave a restaurant with her and just have the Rett wife bag up the food for me and just bring it, and even Anna's, because I mean, if she's that overstimulated, it doesn't do well for her because of that. So there's times we've just had to get up and walk out of the restaurant and leave everybody else, and it kind of makes everybody else, especially my parents, the Rett grandma in here, that's my mom, who's another member here, but it really, it makes them feel bad. It shouldn't, but it makes them feel bad that I didn't finish my meal, or that Anna didn't eat enough or something like that. And it just, we deal with that. We go on with that. We will deal with that when we get home. We'll feed her there where it's a more quietened down, kind of calm environment and everything, or wherever we're going. There's been times that we've even fed her in the car on the way home, kind of thing, just to get some stuff in her. But it's just a matter of minimizing that sensory stimulation. Church is another issue sometimes that happens, and Anna wants. Typically, church and everything, she's had her seizure meds and stuff, and she's getting sleepy, and she just gets mad with all of that, with the music. And I mean, she's usually pretty good with the music. I shouldn't say that, but other things going on around that she just doesn't do as well with. So that's something that you've got to think about, and you've got to figure out what works. And sometimes it's just removing them from the situation. Sometimes that's not good, not fun for us, but it is what it is. So you got to stop and think about that, and you gotta make it what it needs to be for them. All right, and the last thing here, in talking about common things for these kids, is pneumonia. Pneumonia is something that happens with these kids, and sometimes it happens as a result of aspiration, and that is one of the big killers of these Rett kids. Actually, is aspiration pneumonia in general, but aspiration pneumonia altogether. Aspiration pneumonia is where they swallow something that shouldn't have. So it could be reflux. It could be that they swallowed drink and it went down the wrong way. It could be that they swallowed food and it went down the wrong way, went down their windpipe, their trachea. But it gets into their lungs, and of course, if it's come from our mouth or our gut, it's got a lot of bacteria. So when that happens, they can develop pneumonia. And with that happening, with them developing pneumonia, it can get very severe. They can end up with we've seen this with people with pneumonia just from other things too, not necessarily from aspiration, but it's always a concern when we have aspiration pneumonias. But we've seen this with just regular pneumonias. People can end up septic. They can end up with bloodstream infections that kind of go everywhere just from the pneumonia. So you've got to stop and think about that, and you've got to keep that in mind. And that goes back to keeping things clean, with brushing their teeth, with keeping their mouth clean, with doing the best you can for oral care and things like that. That is something else that we have. One other thing that I'm going to mention, and if you've got a Rett child, you already know probably what I'm getting ready to say. Bruxism, which is teeth grinding. These kids grind their teeth. It makes my jaws hurt listening to Anna grind her teeth sometimes. And it comes and goes kind of thing. There's times that when she's really, really sleepy, oh my gosh, that's all she does is sits there and grinds her teeth. Oh, and it grates on your nerves. It's like nails on a chalkboard for me. Holy cow. That is something that these kids have as well. And my goodness, it's something that's annoying and aggravating, but it's something that you've got to get used to. So just be aware of that. Those are some of your most common things. That's kind of your top 13 list of common things with Rett syndrome. So like I said before, when I come back in the next episode, I'm going to be working for a few days here, so it'll be a few days before I get another episode recorded. But my next episode is going to be talking some about the treatments for Rett syndrome and what goes into with that and dealing with the treatments for Rett syndrome. There is no cure for Rett syndrome right now. It is a genetic disorder. It is something that is on the X chromosome, and there's no way to fix that X chromosome right now. So a lot of what we do is just symptomatic. So we're going to talk about some of the symptomatic treatments and things that we have for some of these issues that we've talked about here. So with that, thank you guys for sticking with me. I know this was a little bit long as well, but it is something that I feel is important that we get knowledge out there for people. Remember, you're not in this alone. There are a lot of Rett parents out there. There are a lot of parents with special needs, kids, and you are not alone. Feel free to drop me a comment if you're somebody with a Rett syndrome child or a Rett syndrome relative and you're helping take care of them and stuff and you have questions. Feel free to reach out. Drop me a comment. it is always something that is nice to know that you've got somebody that is like you, and that somebody that goes through what you go through, even though it's something that's not very pleasant. It's always nice to know that there's somebody else that's been there, and that you're not facing it alone. It's sad but comforting at the same time. So, guys, thank you for everything. Don't forget to hit the follow button below, and don't forget to hit the like button if this was informative to you. Thank you, guys, and I'll see you in the next episode of The Rett Dad.